Hello guys, this is me DrKashanQasit. Today here we were discussing the right ventricular wall hypertrophy and the left ventricular wall hypertrophy. Today we are going to discuss the ECG pattern in which you will see the both left and right ventricular wall hypertrophies. So without wasting time, let's come toward the topic, which is the ECG pattern showing the right and left both ventricular wall hypertrophies. So here is the ECG criteria showing both right and left ventricular wall hypertrophies. So now I am going to display here some of the ECGs of left ventricular hypertrophy and right ventricular hypertrophy. So starting from the left ventricular hypertrophy, this is the ECG. You will see here in this ECG, you will clearly see SV1 plus RV6 greater than 35 small square boxes. When you look at this ECG, here there is a mark, arrow mark showing deep S wave in the V1, and there is also tall R wave in the V6. Combining both V1 and V6, you will see there is a clear combination which is greater than 35 millimeter or greater than 35 small square boxes, which is clearly fulfilling the criteria for left ventricular hypertrophy. So this was the ECG of left ventricular hypertrophy. Now I am going to display here another ECG of left ventricular hypertrophy. This is the ECG of left ventricular hypertrophy, in which you are going to see here in the AVL, you will see clearly R wave greater than 11 millimeter, and also when you look at the R wave in V5 or V6, there is a clearly spikes showing the amplitude greater than 26 millimeter, and this is also fulfilling the left ventricular hypertrophies. So both these ECGs are showing the left ventricular hypertrophy. So in order to confirm the diagnosis, you will definitely go for the echocardiography, but these are the ECGs showing the left ventricular hypertrophy. Now come towards the right ventricular hypertrophy. So here is the ECG. This ECG is showing the tall R wave in the V1. You will clearly see here in the V1 there is a tall R wave, and this is showing, this whole ECG is showing right ventricular hypertrophy. So this is also confirmed by same echocardiography, and there is another condition in which you will see both left and right ventricular hypertrophies in the same ECG. So whenever there is a biventricular hypertrophy, means combined left and right ventricular hypertrophies are seen on the same ECG, you will definitely see the changes like tall R wave in the V1 and also V5 and V6. Also in the presence of left ventricular hypertrophy, when there are certain changes or findings in the ECG like RAD, right axis deviation, or the presence of prominent S wave in the V5 or V6, then you will confirm the diagnosis by same echocardiography. But the ECG will be obviously showing the biventricular hypertrophy. Now I am going to display here the ECG of biventricular hypertrophy. Now look at this ECG. This ECG is showing tall R wave in the V1 and V2, also in the V5 and V6. Clearly here the tall waves are seen in the ECG pattern here in the V1 and V2 and V5 and the V6. So this is the ECG showing biventricular hypertrophy. Today we have covered both left and right ventricular wall hypertrophies. The ECG showing both left and right ventricular wall hypertrophies. In the next video we will be discussing the ECG pattern of left ventricular wall hypertrophy with strain pattern and right ventricular wall hypertrophy with strain pattern. We will differentiate between the right and the left ventricular wall hypertrophies with the strain pattern. Hope you like my video. Thank you very much for watching. I'll see you in my next video.